Okay, yes, I think you caught me there. I was playing around with ChatGTP, uh, just out of curiosity. What's happening if as a patient, I do a search on ChatGTP or ask a question: what diet to follow after a gastric sleeve? Well, here you go. You get pretty much the content that you would find on a decent bariatric surgery website. So everyone talks about it, and the big questions for you as a doctor in private practice might be, well, how's this going to affect patient behavior? Are they still going to ask doctors or look at medical websites? Will people just take for granted what they read on ChatGTP or Google's Bard? Those are big questions, and they're good questions. The good news is that habits don't just change overnight, and many of us will probably play around with this and ask questions. Yet, when it comes to choosing a specialist doctor or a surgeon, we will still want to be assured that we're not just asking a robot. And it's early stages, but our vision on data, on market research across Australia in terms of Google search is very clear and crystal clear. People use Google to check out doctors, specialists, and surgeons, and they also use it to do their research. So whatever happens with this one here or Google's Bard, let's do another one. Best orthopedic surgeon in Perth. See what happens. Big disclaimer, I haven't prepared this. There you go. I do not have the ability to make a specific recommendation on the best orthopedic surgeon in Perth. The best way is to do your research, and then it gives you some ways to find the most qualified orthopedic surgeon. So the impact of artificial intelligence, it's a big unknown. We can't predict what's going to happen. The one thing we do know for sure is that good content will always be what artificial intelligence and search engines are going through in order to deliver, whether it's Google search results or an answer to your question. So having your content in order now will just make you stronger in the future. If you specialize in skin cancer, you want to make sure that you're really covering that topic well, and that patient education content is organized in a future-proof way. So user-friendly, patient-oriented, organized in a visually compelling way, and optimized for whatever artificial intelligence engine is crawling through it. And that's the big thing. In order to get good content on your website, you need all of that to work together. Medically accurate, APRA compliant, visually compelling, well organized, personalized to your practice, and optimized for, let's call them the engines: Google, Bard, ChatGTP. So there's work to be done. If you have not engaged yet in content marketing based on research, what your patients are Googling for, based on monthly or quarterly reviews to look at your visibility for your main keywords, now is the time to start. Actually, it was yesterday, but now's a good time to start. With all this new artificial intelligence going through your content and your competitors' content, you want to make sure that you stand out. If you need some help, just book a free strategy session. We'll talk about your digital presence in full detail and give you some powerful future-proof advice on how to set up the digital side of your private practice.